Welcome to our third episode of Antibiotic Answers, where we take your antibiotic questions and give short guideline-based answers while focusing on using antibiotics appropriately and preventing resistance. Please feel free to submit your antibiotic questions to emily.perry@ndsu.edu. This episode is on acute uncomplicated cystitis. Our first question is, what is asymptomatic bacteriuria? Asymptomatic bacteriuria is the presence of one or more species of bacteria growing in the urine at specified quantitative counts, like greater than or equal to 10 to the 5th power colony-forming units per milliliter, or greater than or equal to 10 to the 8th power colony-forming units per liter, irrespective of the presence of pyuria in the absence of signs or symptoms attributable to urinary tract infection. Our next question is, what patients should not be treated with antibiotics for ASB? Patients that should not be treated with antibiotics for ASB are geriatric patients that are either functional or cognitively impaired, long-term care facility patients, diabetic patients, kidney transplant patients, or other solid organ transplant recipients, patients with impaired voiding due to spinal cord injury, patients with a long-term indwelling catheter, patients undergoing elective non-urologic surgery, or patients receiving implantation of or living with a urologic device. Our next question is, what patients should be treated with antibiotics for ASB? Patients that should be treated with antibiotics for ASB are pregnant patients who should receive 4 to 7 days of treatment, and patients undergoing endourological procedures who should receive a short course, 1 to 2 doses that start 30 to 60 minutes before the procedure. Our next question is, what antibiotics should be used for a patient with acute uncomplicated cystitis? The choices are nitrofurantoin monohydrate or macrocrystals 100 mg PO twice daily for 5 days, sulfamethoxazole trimethoprim 160 mg by 800 mg twice daily for 3 days, with alternative choices of amoxicillin clavulanate, ceftonir, cefaclor, or cefpooxyproxetil, with all of those antibiotics being a 3 to 7 day course. Thank you for listening. If you have a question you would like answered, please email it to emily.perry@ndsu.edu.